Good morning, everybody. It's 11 minutes past 7 o'clock right now, and time for the Orthopedic Minute, which means it's time to visit with our friends from DMOS.
That's
Michelle.
right. And joining us here this morning, Mark Fox. Thank you for coming in here today. You have an interesting topic to talk about. But first, we want to talk about your title.
Yeah,
You're an interventional physiatrist.
Physiatrist. I don't think I've ever uttered that word before this morning. What in the world is a physiatrist?
You wouldn't be alone. I think a lot of people confuse us with psychiatrists or podiatrists. What a physiatrist is someone that specializes in rehabilitation of chronic musculoskeletal conditions as well as traumatic events like spinal cord injuries, strokes, things like that. It's something that developed around World War I to kind of cope with all of the soldiers who were coming back with injuries from explosions, things like that, and then it's kind of evolved from there.
Now, this is your specialty is concentrating on sports medicine, non-surgical sports medicine, which I find unusual. And you've worked with some pretty big teams over the years. Why don't you tell everybody who you've worked with?
So I've worked with the Dallas Stars, the Cleveland Indians, the Cleveland Cavaliers. Right now I'm working with Simpson College. It's really, going back to college is really rewarding. You see a different level of enthusiasm and excitement in the kids. So
yeah, and at that same time, that different level of enthusiasm and excitement could lead to some injuries that could need your services, and that's exactly what we're talking about here this morning.
Yep.
Okay, now we are specifically talking about something that is called one sport name. It has a name of a sport, but doesn't necessarily mean you have to play that sport in order to have this injury. We're talking about tennis elbow. Why don't you explain what this is all about?
So tennis elbow is interesting. It does happen in certain tennis players, but what it is tendons are things where the muscle attaches the bone through a tendon. The muscles in your forearm that bring your wrist back, bring your fingers up, and bring your palm up, all attach to the same place on the outside of your elbow, called the lateral epicondyle.
Okay.
So tennis elbow is fatigue, either an injury or just chronic stress of the tendon that attaches to the outside of the elbow. So people that do repetitive things or have injured themselves, bringing their wrist back, bringing their palm up, and bringing their fingers up, as you can imagine, typing, different things like that. It all puts a lot of stress on the outside of the elbow, and that's what's called tennis elbow.
All right, so somebody working on a computer, for example, could develop what is considered tennis elbow.
Mm-hmm. Yes.
Maybe that just that constant repetitious activity.
A big one now, I mean, it's similar to tennis, but I'm getting a lot of pickleballers.
Of course, pickleball, that's getting very popular.
Pickleball.
Yeah, so pickleballers have been very common, and then people who like to do home improvement projects who are maybe using the wrong tool for these, instead of power drills, hand drills, things like that. That's all really putting a lot of force on the outside of your elbow.
Okay, and how long does it take to injure yourself in order to need something done?
So that's a great question. There's, typical injuries you'd think of with athletes where they do something very traumatic and they may tear the tendon or do something like that. That would need treatment pretty much immediately. But there's a large population of people who over the course of weeks to months have done something repetitively, and it just kind of starts up slowly, and then they noticed, 3 months later, man, it's really hurting. I'm not sleeping. It's waking me up if I bump it.
Is this something that would hurt all the time? I'm trying to diagnose if anybody out there does have this. Is this something that is throbbing all the time?
Yes.
How does this affect
you? You know if you have it.
So commonly, you know if you have it. You've tried a bunch of different remedies. People have straps, ice. They go to chiropractors, all that sort of stuff, and nothing seems to get rid of it. It's really just a throbbing on the outside of the elbow. If you bump it, it can be really tender. Again, you can roll on it wrong at night and it'll wake you up. There's a lot of different ways that it bothers people.
Didn't know that.
So are there ways, and when we are doing activities that we do have that repetition and kind of in that area, are there things we can be doing to kind of prevent this from happening with maybe some exercises to offset it?
There are. We call it activity modification, but there are definitely, if you have poor technique in certain things, in terms of using some of your muscles too much, that can definitely cause it. A lot of times it may take a physical or occupational therapist to help you identify those, or a physician to help you identify those things that you may be doing that are making it worse.
Yeah, Dr. Mark Fox joining us from DMOS here, talking about what you can do if you're having problems with your elbow, what some people call tennis elbow. But what can you do with this? Because you have something new that is first in the state of Iowa, and no surprise, DMOS has it. Tell everybody what you have.
So this is something that I was doing for several years at the Cleveland Clinic. Done hundreds of them there. something I wanted to bring to Iowa. It's called TenJet.
TenJet.
Yeah,
okay.
That's the proprietary term. The medical term is percutaneous tendon debridement, or some people will call it a percutaneous needle tenotomy. Tendon debridement, I think, is a better term for it, because what you do, the tendon is supposed to be really organized like a strong rope with hundreds of fibers all going the same way. Muscle pulls on the tendon pulls on the bone. But in these diseased tendons, it becomes really thick and bulky, and almost like balled up fishing line.
Oh, sure.
And so what this procedure does, and it's in the office, no general anesthetic, you don't get put to sleep. We numb it up really well, of course. And then the needle on the TenJet machine actually sprays high flow water back into itself, causing a sort of suction. And what I describe it to patients, it's kind of like a carpet cleaner. So it sprays the carpet, grits rid of all the dirt and grime, and then leaves the carpet behind. And the TenJet's very similar. You pass it through the diseased tendon, it helps clean out all the bad tendon and leaves the good remaining fibers behind.
So if things get lined up again, is that the whole idea?
Yep, so you clean it out. It's, it's like remodeling a home, you got to do demo first. So you clean it all out with the machine, with the TenJet, and then the body's able to actually go in and do the proper healing that it meant to do months before.
How cool
Very
is that?
nice.
Yeah.
I would imagine people like these kind of less invasive type of procedures and not having the anesthesia and all of that.
Very much. Not only is it, I think, more comfortable for the patients, you do need a driver, but you don't need to be NPO, we call it, or without food before. You don't need to worry about any sort of anesthesia risk. And they come in, they get the procedure. There's still a few weeks of some sort of activity modification or immobilization.
Okay.
But they tend to kind of go about their usual day much quicker.
Wow, that is absolutely amazing. And what was the alternative before this TenJet?
Well, there's not a great alternative, actually. So the alternatives were repetitive steroid shots. Steroid shots are very helpful in decreasing the pain almost immediately. The typical thing that we hear from patients is, gee, it felt great for the first 3 to 6 months, and then the pain came back worse than it was before.
Wow.
And I've had repeated steroid shots, and now every shot lasts less and less time. So that used to be, and still is, I think, in certain instances, a good option. From a surgical standpoint, there's not any great options. They do a similar thing to what I do, except for they have to open up the skin to take a look at the tendon and actually use a scalpel blade, whereas I use ultrasound so I can see the tissue without opening the skin. So I use ultrasound to look at the tissue, and then I pass the needle through the
So a needle
tissue.
goes in, and that's it?
Yep.
That is
Wow.
absolutely amazing. See,
Skills.
you learn something new here every day, and this is exactly the case right here. Interventional physiatrist Dr. Mark Fox here from DMOS. And if you have anything going on with your elbow in particular, this is the procedure that you suggest.
Yes, most often.
Most often.
I do suggest going to a physician to see. Sometimes there are mimicking problems, but yes. If it is tennis elbow, this is a great option.
All right, there you go. That's how you get a hold of our friend
DMOS.com.
over at DMOS. Thank you so much.
Yeah,
That is
thanks
really
a lot.
cool. Thanks for
Yeah,
being
thank
here.
you.
Doing good work.